Hi, my name is Cindy. I am a Waterloo graduate of 2012. Currently, I'm working in the Children's Hospital of Eastern Ontario in Ottawa. My primary role is working as a pediatric intensive care pharmacist as well as the neurology pharmacist. My main roles in pediatric intensive care include doing a lot of drug information, going on clinical rounds on a daily basis, participating in antimicrobial stewardship rounds, making recommendations there, doing a lot of therapeutic drug monitoring, as well as attending codes on the wards and in the emergency unit. In that case, I would do a lot of suggesting. I would calculate doses, draw up the medications, and also do a lot of consultations if there's drug interactions, as well as looking for, I guess, contraband medications and identifying those.
Sure. I'm involved in a variety of projects at ISMP Canada. One of my main roles is to help and provide support to pharmacists in regards to quality assurance activities as well as medication safety incident reporting in community pharmacy practice. So this entails providing presentations regarding medication safety as well as providing training on how to implement these programs through the use of ISMP Canada's Community Pharmacy Incident Reporting Program. I'm also involved in research activities which focus on pharmacy practice integrated with clinical topics such as drug-drug interactions, which was the topic of our most recent research project. So this specifically entails data collection and evaluation, writing research proposals, as well as knowledge dissemination through publication opportunities and presenting our work at conferences. And finally, I'm involved in education here at ISMP Canada, and this involves delivering workshops and presentations in regards to medication safety initiatives, concepts, and methodologies. I've been fortunate to have had the opportunity to present at international pharmacy conferences on behalf of ISMP Canada in places such as Beijing and in a country called Oman.
So I did a few things in my role as a long-term care pharmacist. One of them was to review medication regimens of the residents at the home at least quarterly. So I'd go into the home, review the chart, look at their lab values, any progress notes, talk to the nurse about what might be happening, and make recommendations to the physician about changing medication therapy. And a lot of those times, those recommendations involved either stopping or reducing the dose of the drug. So it's not always just adding things on, especially in the elderly population. There's a lot of deprescribing there. I also did in-service education for staff at the home, so a lot of the nursing staff and PSWs who are administering medications, as well as for patients and families. If there was ever a clinical question from prescribers or nurses or anyone at the home, I was always available as needed to answer those questions, so either by phone or by email as needed. And I'd also assist with med management in the home, so whether that's storage or administration of the medications, things like narcotic destruction, reviewing medication incidents, and being involved with medication safety at the home. I was all part of as a clinical pharmacist in long-term care. And finally, I was involved with helping to review and develop clinical initiatives by the pharmacy. So these are things like programs. So for example, the flu program, again, different in-service education that not only I provided, but also other pharmacists throughout our organization. Things like newsletters and medication-related tools for staff at the home.
As a mental health pharmacist, my role is I do 40% clinical and 60% order entry. As a clinical pharmacist, I help with talking to patients, mostly managing side effects, providing a round with all the doctors and provide solutions for patients going home. I manage funding for different medication, and I basically try to make everybody's life a little bit easier despite their disease.
What prepares you best for this position from your years of school in Waterloo?
First and foremost, I would say all of the co-op experiences that I've had. I did each of my co-op terms at different pharmacy settings, And the exposure to each of these settings gave me a broad sense of the different aspects of pharmacy practice. And that exposure helps when I'm analyzing medication incidents or when I'm interacting with different healthcare professionals or stakeholders through my work at ISMP Canada. So that's the first part. I think another thing that really helped was all the presentations that we had to do in school. I remember we had quite a few presentations throughout our program and our curriculum, and so with all the presentations that we had to do for all of our courses, you can't help but get used to presenting in front of large audiences, and I think all that practice paid off because I feel more comfortable, and I became more comfortable with giving presentations, especially here in my current role at ISMB Canada.
A few things prepared me best for this position. One, I would say, is just the therapeutic and patient care process. So being able to review someone's regimen was really important in my day-to-day practice and be involved in optimizing their drug therapy. Also, I would say courses and classes that we had throughout the program around geriatrics, and specifically an elective I took around geriatrics and long-term care. That was very useful as I moved into this position as a long-term care pharmacist. And finally, I would say practical placement. So I did my last co-op rotation in long-term care with a clinical pharmacist. So I really got hands-on knowledge about what's involved in this position, what I needed to do as a clinical pharmacist, and just the practical aspects of the job itself.
I think certainly the IPFC course prepare you somewhat, but as you graduate, you'll soon find out that you really know nothing when you graduate. And what the IPFC prepares you to do is how to learn on your own. And on top of that, what's important is, I think, what extracurricular activities. So clubs you join or people you meet along the way. And I think co-op was a big impact as well, because you actually know what it is like to work as a pharmacist.
Oddly enough, the first thing that comes to mind is a lot of the presentation skills. Waterloo was great in that it gets you over a lot of your stage fright, and every day the reality is when you're presenting to your colleagues and to doctors, nurses, and even to families, a lot of that comes down to not being nervous and being able to, I guess, convey your message in the clearest way possible. So that was one thing that Waterloo prepared me for. Obviously, the basic knowledge, understanding pharmacokinetics, and basically being able to know where to look for your resources or the information you need. Those are the main things that really prepared me at Waterloo.
So what would you advise a student who may be interested in pursuing a similar career path? So if you're interested in pursuing a career in long-term care as a pharmacist, I'd recommend a few things. First and foremost, if you can get any experience, whether that be through a placement during school, such as a co-op position, even applying for a part-time job. So that was another thing that I did during my last year in school. After I had completed a co-op, I actually remained as part-time at that organization, just doing meds checks and helping at a local long-term care home in the area. So any hands-on experience that you can get would be really useful. But even if you don't have that, there are a few options that you can help boost your resume to tailor to the sector. One of them is actually a collaborative effort between the University of Waterloo and the Ontario Pharmacists Association. They have an online course, I believe it's like less than $100, and it speaks not to the clinical aspects around geriatric care, but to the practical things in long-term care, because there's different legislation, different operational things that you need to know as a pharmacist in the sector that aren't really traditionally taught. So I would highly suggest that anyone interested in pursuing this career path take it. Even if you're interested in doing maybe relief or a part-time or casual position, it's not very time-consuming and it's relatively inexpensive and will really boost your knowledge. And then if you're interested in more of the clinical aspects around geriatric care, another option is pursuing your certified geriatric pharmacist designation. So that's a more comprehensive and definitely a worthwhile initiative and would be helpful for someone who wants to move towards this career path. So best of luck.
Okay, so in terms of getting into mental health, there's many different paths. CAMH offers a residency, and certainly London and Hamilton offers mental health rotations. But in terms of getting into hospital pharmacy, I think a lot of you do want to get there, and I just want to make a couple points clear is that residency will give you an edge, but it's not everything. I never got my hospital residency, but I've been working in hospital ever since. Make sure you talk to the people that are in hospital and know how it's like. And you might not like it when you come work. So, and finally, I think just if you really want to work in hospital, just don't give up. Jobs will come out, and I know, like, my career path was very different from what you would think. I never got a residency. I started my career working at ISMP. I got my internship in a community pharmacy, and I had the opportunity to work in Waypoint Center, which is a specialized mental health hospital. And my career moved on from there. So make sure you don't give up and just look for opportunities whenever you can.
Encourage everyone to try something new and try to go outside your comfort zone, because you never know if you'll get these opportunities after you graduate, and that's partly one of the reasons why I applied to ISMB Canada for one of my co-op terms. And along those lines, if your preceptor gives you an opportunity that's new and challenging, I'd suggest to try it. It's the only way you'll learn and gain exposure, and you can determine if it's something that you like or if you don't like. Having said that, though, you'll often find that your preceptors, your supervisors are very busy with their own jobs. So try to show initiative and ask for more opportunities as long as it's within your scope and it's reasonable. By showing initiative and being proactive, it'll demonstrate that you're interested in your work, and it'll showcase the value of pharmacy students. I'd also encourage everyone to become comfortable with networking and showing dedication to the job. You never know who you're going to meet during your co-op term, and you never know if the company or organization that you're working for your co-op will be hiring pharmacists by the time you graduate. And becoming comfortable with networking will give you an advantage to be able to return to that job after you graduate. It's quite a long list, but those are some of the pieces of advice that I would give.
That I'd actually recommend is try to do it as early as possible in your career. Do it when you're pretty much fresh out of school, when you're used to having things thrown at you. As every day in the pediatric intensive care unit is a gigantic surprise. So when you're fresh out of school and you're used to looking up and using all of those resources, and you have a lot of the knowledge from your degree program, I find that it's very much use it or lose it in the world of work. So the fresher you are, the more knowledge that you have behind you is fantastic. As well, don't be scared to ask your peers questions. You'll find that you're thrown into an area where there are tons of people with a world of knowledge behind them, and you might feel intimidated, but a lot of those people will be the best resources you will ever find in your entire life. So I would be that person that is curious, that asks a lot of questions, and is definitely willing to learn. And on that matter, you have to be your own advocate, because the younger that you pursue something like this, the more you're going to have a lot of people questioning whether or not you're ready. And if you're definitely gung-ho about this role, you can definitely prove to them that you're ready for the challenge and actually be ready for that challenge. All right, thanks, bye.